These micro pumps for micro pump artificial hearts are very small in size, about 30 grams or so, and there is only a small moving part inside, and it can pump up to 4 liters to 5 liters of additional blood into the circulation, giving better cardiac out for the patient. These micro pumps still in the clinical trial only, likely to come into clinical practice maybe in another 3 to 4 years time. These micro pumps, they are attached to the chamber of the heart, and a small battery is there which can be kept under the skin, and this battery can last longer. The life of batteries can be for months or even years, and these batteries can be recharged through the skin, what is known as a transcutaneous charging of the battery. These micro pumps at present are implanted through a small surgery and doesn't need an open heart surgery. It is in a small surgery in the chest to fix this, to suture the one end of the pump to the heart and another end to the another major blood vessel like aorta or brachial or axillary arteries or subclavian arteries. And there is no wires coming out from the body, that's why there won't be any infection or so. So in the future, these micro pumps will be modified in such a way that they can be fixed to the heart without an operation through catheter based technology. So when that comes, it will be the implantation or the fixing of this heart, artificial heart, the procedure will be much more simpler and very safe, and it will be depend on catheter based. And when that comes, definitely about 3 to 4 crore people, or about 40 million people who are suffering from mild to moderate heart failure will have a very better chance of living and leading a good life, as these micro pumps can support their heart and pump additional 4 to 5 liters of blood, which will improve their quality of life as well as longevity of the life. So cardiac failure or end stage heart disease, once thought that we cannot do anything on these patients except give them certain medication and change their lifestyle and wait for the death only, the scenario is very much changing to what is known as a very innovative as well as some sort of a curative treatment for these kind of patients who are suffering from mild, moderate to severe heart failure through the artificial heart technology. Now the question is how this artificial heart technology will be useful in Indian scenario. This is a very important question, because heart failure patients, the majority of the heart failure patients are seen in India. Almost 50% of the world's heart failure patient is supposed to be in India. That is what the statistics says. So naturally the burden of treating the heart failure patient falls on India too. How far this artificial heart will be useful in Indian patients is because, number one, it is very costly. It costs nearly more than 10 million Indian rupees. So how much Indian people can afford for this? Number one. Number two, what are the infrastructures we have to deal with the patients who suffer from severe heart failure and transport them to centers where they can be managed with the artificial heart? That also is a very important thing, because in end stage heart disease, the transportation of the patient to the major centers where this kind of destination therapy through artificial heart is a very important factor. So we have got a limitation there also, as well as we have got a limitation in many other areas. So that's why still now the artificial heart technology has not taken up in India. But definitely India is a one country which definitely can have this program, and it will be needed here, no doubt about that. The one alternate method we can work out is to develop our own artificial heart by research by Indian scientists and Indian doctors, and using the material available here, so that these artificial hearts can be manufactured at a low cost, something like less than 1 million rupees or so, so that once that comes to that level of cost, I think more and more patients will be benefited. The solution for heart failure patient in India seems to be an intense research, as well as develop our own artificial hearts, which will be useful for Indians and affordable for Indians. That's why majority of the people suffering from heart failure in India can be saved, and their life can be extended, and their life can be made more pleasant.